Hi everybody, my name is Clay Volkman. I'm the hearing provider here at Advantage Hearing and Audiology in Greensboro, North Carolina. And welcome to everyone today. And today we just want to talk about our topic is going to be what to expect when you first take home your new hearing aids. Before I kind of go through the steps, what to expect, this is really important. You probably heard, if you tuned in before, you probably heard us mention that we hear with our brains and not with our actual ear. So when we hear sounds, it does go in our ears, and our ears process the sound through our ear canal to our middle ear into our cochlea, and then the sound actually we hear up in our brain. That's where we actually process the sounds. So being a first-time hearing aid wearer, when we are going to send you home with your brand new hearing aids, it actually takes your brain 3 to 6 months to get used to the new sounds that you're not used to hearing, whether it be a long time of going without hearing, at full capacity. That is going to take some time for your brain to get used to. So we would not send you out the door with your hearing aids at full target. We call it target or goal, your goal for your hearing, because that process involves you and your feedback to us. And it's going to take a few appointments and then ongoing appointments for the life of your hearing aids. So with that being said, normally what we like to do is when you're here for your fitting, we like to go ahead and schedule 1 week from that fitting for you to come back. And what we do at that time is we want to keep that first week really, really basic. So we want you to get used to wearing them. We want you to wear them as much as possible. And we want you to take some notes on how you're hearing during that first week. And we just want you to get used to putting them in the morning, taking them out at night, how to store them at night, whether it be if they're battery operated. We're going to get you a dry aid kit that you'll put them in at night that will actually, while you're sleeping, it will pull any moisture out of the air, anything. It will pull those out of the hearing aids. Or if you have rechargeable technology, we want you to just get used to putting them in the recharge base. A lot of hearing aids are coming out with that these days. That's what a recharge base looks like for the hearing aids to go in. So we're going to try and set up a plan. So what to expect is maybe to come back 1 week after your first visit. After that visit, we'd really like to see you again in another week, because each time you come back, and I'm going to refer back to this, like I said, the brain takes 3 to 6 months. So each time you come back for a follow-up appointment, we are going to ask you how you're hearing, and we're going to baby step up a little at a time as we need to get you to a targeted hearing where you're hearing really comfortable, where you're hearing like you should be hearing. So whether it be one time a week for the first 4 weeks, which is what we like to do, but if the patient, may have a situation where they have issues that they can't get here that often, we'll work that out on an individual basis. But as a goal, that's kind of what we like to set right off the bat. So during that when you first take your hearing aids home, we really would like for you to take notes on how you're hearing. Some of these situations would be on a one-to-one, talking to a family member or a friend, just one person to one person. Take some notes. How are you hearing in that environment? Another one, a big one, is how are you hearing when you're watching TV, when you're listening to music on the radio or, on your iPhone? How are you hearing on the telephone? And especially, how are you hearing when you go to the grocery store, to a mall, to a restaurant where there's going to be background noise with music playing and dishes clanging and other people at other tables talking. So that it's real important, you know, in the first couple of weeks for us to be able to do the correct adjustments, for you to feed back to us how you're hearing. And all of that information we're going to take, you know, and we're going to do our adjustments as needed, getting that information back from you. So the goal that we want to reach is to try and get you to reach the most comfortable and natural hearing level possible, okay? And with those return visits, with those adjustments, with you getting used to the hearing aids, we're hopefully and almost always reach that goal. And, you know, sometimes it takes a few more weeks out, you know, with different situations, but we hope to achieve that, you know, within, you know, a certain time frame. And then we're going to get you on a schedule where we're going to see you for a long time, hopefully for the rest of your life. But we're going to get you on a schedule where we'll see you every so often, hopefully once every 6 months, even if we just clean the aids for you, listen to them. We stay in contact with you. We know you're doing great. And that's kind of a goal we'd like to get to. Just a real quick question that sometimes people ask, they don't know when they should contact us. We like for our patients to feel comfortable contacting us whenever you need to. That's what we're here for. Even if you have an appointment set for a month from now, if you're having an issue, please call right away. You know, if you had glasses and they broke, you would definitely contact, you know, the doctor about you getting new glasses. This is the same way with your hearing aids. When you're having an issue, we want you to call us. So feel free to call us anytime. I don't want to make this too long, but we want you to get off to the best start possible. And the key to satisfaction is to make sure that you wear the hearing aids as much as possible. You wear them in different listening environments like the TV, the restaurants, family gatherings, anywhere you can. And in so doing that, we're going to be able to help you achieve the best hearing levels that you can hear and get the best out of life. Okay? So I hope everybody got something good out of this today. And if you want to give us a call, and we encourage you to come in for a free hearing exam here at the Greensboro office, we're at 336-271-4944. And I hope everybody has a great day. Thanks for tuning in.